Good afternoon. We'll be starting the webinar shortly. We're just waiting until everyone who signed up can join. If you have any questions now or throughout the webinar, you can write them in the chat box or the Q&A box, and we will address them as they come in. Or at the end of the webinar, we'll be able to unmute people so you can ask your questions and get them answered live. After this 30-minute webinar is when we'll be answering live questions. And again, to ask a question live, you'll wait till the end of the webinar, and then you'll be able to use the raise your hand feature in Zoom to ask your question live. We can unmute you and we can be happy to help you.
Thank you, AJ, and thank you everyone for joining our pre-enrollment webinar program today for the Clean Water for Georgia Kids. This program is a partnership between the Georgia Department of Education, Georgia Department of Early Care and Learning, and RTI International, a nonprofit research institute. My name is Crystal Lee Powell-Jackson, and I'm one of the program staff here with the Clean Water for Georgia Kids program. We also have Jenny Haponic-Redmond, the program director, AJ Kondash, the program coordinator, Erica Wood, the outreach and communication coordinator, and other program staff. So who is eligible for grant funding right now? We are enrolling public schools, childcare license centers, and family childcare learning homes. School and childcare facilities must be fully opened or operating at reduced capacity. They also must not be closed for the summer. If we get more interest than we have funding to test, we'll prioritize elementary schools and schools in underserved communities that may have more student populations with free or reduced lunch. By the way, if your childcare program is moving or adding a location, or working on obtaining your license, the Georgia Department of Health has a program called the Safe Citing program that can help you choose a safe location for children to grow and play. DPH can screen your proposed facility for harmful chemical hazards, and their information is here on the screen.
Our agenda today is to first give you a background on lead and our program. Second, overview pre-enrollment training videos on how to sign up to enroll on our website, how to collect your samples, and how to ship your samples. After the webinar, we will give you the enrollment PIN number. That's what you need to sign up on our website. After we give you that, feel free to give us any questions or comments you may have, either in the chat box or by asking us live. So first, we'll overview a background on lead. Lead is a heavy metal that's been used in a variety of products for hundreds of years. Some of the products it's been used in included paint and gasoline. While there have been bans for lead in paint and gasoline, it is still allowed in piping, plumbing, and solder to varying degrees based on the age of that water infrastructure. This is important because lead exposure causes lifelong cognitive and behavioral deficits in children. And this actually happens at any level of exposure, and it's irreversible. It can cause things such as lower IQ, decreased ability to pay attention, and underperformance in school. Okay, so why is this important? Well, as I mentioned, lead's been banned in paint and gasoline, but there still are allowable levels of lead in our piping and plumbing in the United States. It's important to note that we usually don't find lead in source water or at the water system. It can accumulate on the way to our building from the distribution piping and building plumbing. The lead service lines and goosenecks that might connect water to your school or center can sometimes be the source. And also indoor plumbing, faucets, and solder can cause lead in your water sometimes. There have been several efforts to reduce lead in drinking water over the last several decades. This includes regulations of the allowable amount of lead in plumbing, with regulations in effect in 1988 and most recently 2014, which reduced the amount of allowable lead. There also was a regulation on lead allowed in water fountains in 1990. In 1991, the lead and copper rule was enacted, which provides an action level for public utilities. And that same year, the Environmental Protection Agency noted that there should be a goal of 0 lead exposure. In 2016, the American Academy of Pediatrics recommended 1 part per billion as a reference level for lead exposure to get as close to 0 as feasibly possible. And most recently, there have been revisions to the lead and copper rule, which haven't yet gone into effect. Now I'm going to briefly overview our 2017 Clean Water for Carolina Kids pilot study, which formed the basis for our program. Our pilot study objectives were 1, to characterize lead in drinking water at licensed child care centers and elementary schools in North Carolina, and 2, pilot a novel citizen science-led approach that's scalable with limited resources. Our approach includes the use of citizen scientists and mail-out test kits. So interested participants are able to enroll and receive training on how to collect samples and then ship water samples, where we analyze it at RTI laboratories. Importantly, we provide all of the results, and we provide them in the context with communication and mitigation recommendations. So we help to show what can be done to take action once you identify where there is lead, so that you can get the lead out of all drinking and cooking taps at your school or center. Our pilot study results were striking. We did find that lead was detected above 1 part per billion, which is about a drop in a typical backyard pool. And we found that in 63% of centers, including elementary schools with pre-Ks or Head Starts. We also found 97% of centers had at least 1 tap with detectable lead, which is 0.1 part per billion. 1 in 6 centers contained lead at or above 15 parts per billion in at least 1 tap. And very interestingly, there was a wide range of lead across taps within the same building. So that really showed us that's important to test for lead at every tap you use for drinking and cooking. And you can't assume that by testing 1 tap that all of your other taps are okay. Our approach received several awards, including a Harvard Roy Award for Environmental Partnership and an Environmental Business Journal Award, based on our ability to scale up lead testing and provide steps to help others take action to get the lead out. We then were fortunate that the Environmental Protection Agency has issued federal grant funding to support testing statewide at Georgia and other states across the US. Now, this testing grant covers costs for the actual testing, and we provide recommendations for risk mitigation and communication. It does not cover risk mitigation costs at this time. Now I'm briefly going to overview how we went from the pilot to the program. Our overall mission is to identify and eliminate lead in drinking and cooking water where children learn and play across Georgia. As a participant, we will walk you through the process with training support, a mail-out test kit, lab analysis, and our online enrollment reporting and communication portal. And we really want to highlight that your support as a citizen scientist will allow us to improve the health and lifelong potential of more children throughout the state of Georgia. So we thank you in advance for your participation. In the next sections, we're going to show you specifically how to enroll on our website, how to sample, and how to ship your samples.
Okay, so today I'm going to walk you through enrolling in the Clean Water for Georgia Kids program. We have an online portal to enroll for the Clean Water for Georgia Kids program. To start, go to www.cleanwaterforuskids.org/Georgia. At the home page, you can read about the program goals and methods by scrolling down. To begin enrolling, click this blue Enroll Now button. And today we'll go through the types of information you'll need to include, and you can think about whether you'll want to add additional personnel to help with the enrollment questions. We have a how-to video available on our website or on YouTube that walks you through all parts of the enrollment. So first, you'll select either a public school or child care facility. You'll need to attend one of these required pre-enrollment webinars to receive a 6-digit enrollment PIN to continue with the enrollment process. To complete the enrollment survey, you'll need information about your facility and the students who attend. You will need specific information about your facility. This includes an inventory sketch of taps in your building, brand of water filters and maintenance information, age of building, and if there was any renovation to the faucets or plumbing, and when those renovations may have occurred and what types of renovation. The drinking water source for your building and whether it's from a community water system or water utility or a private well. You will also need information about the students enrolled. This includes the number of students enrolled, the range of grades or ages, percentages receiving free or reduced lunch, and the race and ethnicity percentages of students. School opening information like summer school, fall schedule, and how the COVID-19 pandemic has impacted operation. It is also useful to have this information handy before you begin enrollment. It's okay to have the student enrollment information from this year or the prior year, and for childcare centers, try your best to estimate. As you continue through the enrollment, the first step is to search for your school or center by name or facility code. If you work with more than one school or center, choose one here to start with, and you'll be able to add the others later. When you enter your school's address, you should use the address where you'd like the test kits to ship. If your facility is a licensed child care center or home, you will not need to update your address. Next, you will create your Clean Water for Georgia Kids username and password. Through your account, you'll be able to add users to your account and also add other schools or centers. Developing an inventory will make the enrollment and sampling process easier. Writing down a list or drawing a sketch are great options if you do not have the inventory sketch of your facility. Before enrolling, walk through your building and document the locations of every cooking and drinking tap. It is important to only collect water from taps that are used for cooking and drinking. There is no need to sample water at taps like bathroom sinks or mop room sinks if no one is using them for drinking and cooking. This will cut down on the number of samples you will need to collect. Our enrollment system is organized by classrooms, kitchen cafeterias, water fountains, gyms, outside/playgrounds and fields, and others. So be sure to make a note of where the taps are located for the enrollment process. In the final building information section, we'll ask you to list all rooms in your facility that have drinking or cooking taps. This will be useful to use your inventory sketch. Add the room name and number and a nickname so you know which room it is. To add a new room, push the Add Room button. If you need to remove a room, click the Remove button on the right. Once you're satisfied with your room list, you can move to the next section. Do not add gymnasiums or cafeteria to this list. They'll go separately. Then we'll ask you to list any taps in your kitchen or cafeteria that are used for drinking or cooking. To add a tap, push the Add Tap button. When listing a tap, we'll ask you for a location, a tap name so you can identify it when you receive a test kit. Then we'll ask if the sink is filtered. If you have a sink that has multiple taps, such as a 3-compartment sink that has multiple faucets, we'll ask you to list each faucet separately. Here I've added the left kitchen sink and the right kitchen sink. Once you're satisfied with your selection, you can push Next to continue. Next, we'll ask you about any water fountains that are in the hallway of your school or building. If you have a bottle filler or drinking spout on your fountain, you should list both separately in separate rows. So here I said hallway 2nd floor bottle filler for the first one and hallway 2nd floor fountainhead for the second one. Once you've added all of your hallway fountains, you'll click Next to continue. Note that you do not need to list classroom water fountains here. They will go in the classroom section. The next few steps will take you through gym, outside taps, and other taps. Remember, you do not need to test any landscape hose, utility sinks, or other taps that are not used for cooking or drinking. Then we'll go through each of the classrooms from the building information survey in step 1. Remember that we want to take a sample from each tap that can be used for drinking or cooking. If there is a sink in that room used for drinking and cooking, you should click Add another tap and add it. If there is no sink, you can leave this section blank and click Next to move on to the next room. In the review section, you will see a list of all the taps in your school. We will send you 1 bottle for each tap listed here. If you don't see a tap listed here, you won't be sent a bottle for it. So push Previous and add that tap to the appropriate section. Or you can add it in the other section if you can't find where it goes. In this case, the school here will receive 5 bottles to test each of the 5 taps listed here. When you are satisfied with this list, push Continue to the next section. The next section will collect information on drinking water source for your building, student demographics, water filter usage, and maintenance and school schedules. The last page of the survey will ask about how COVID-19 has affected your operation and ask you to confirm that you will follow the sampling process outlined in our instructions to the best of your ability. Once you agree, click Submit Enrollment Survey, this blue button here. If you push the gray one, it'll just save and sign out. You won't be sent a test kit until you log back in and hit the Submit button. When you submit the survey, you'll be returned to your program dashboard where you'll be able to begin enrolling your next school or add additional users. You'll also see this Enrollment Complete section. If your enrollment for your school is not complete, you'll see the Continue Enrollment Survey button, which also will be in blue. Remember that we have a video on our website that walks you through the enrollment process and has tips for questions in each section.
So now that we've showed you how to walk through the enrollment portal, there are a few common questions that people have as they start their enrollment. The first question is, if we're closed, can we sample while we're closed? And the answer is yes. Please reach out to us for specific guidance on that situation. People also ask if they need to sample if their building is on city water. And the answer to that is also yes, because lead is usually found from the piping and plumbing, not the source water or from the water treatment plant itself. You really won't know unless you test. Another question is, what if you don't know your all the school's building information? Where should you look? And you could ask another staff member or administrator, and they could also be members of your Clean Water for Georgia Kids portal. On some of the questions, you can give your best estimate. For room and tap information, you can look at your school's inventory sketch or do a walkthrough of the building. The next question we get a lot is, does this program cost anything? And the answer to that is no. Right now, testing is free for any public school or licensed childcare facility that's interested in participating in the program. We currently have funding to test up to 800 schools, so we encourage you to enroll now while the funding is available. And finally, we've been asked, does this program include private schools? Because it's a federally funded grant program, that federal funding only covers testing at public schools and childcare centers. If there are private schools, K through 12, that are interested in testing, we'll be releasing a portal soon that will also allow private schools to purchase test kits to participate in the program, but they won't be able to receive the free testing. Some centers and schools have temporarily shut down or restricted access to water fountains or particular water taps, either because of COVID-19 or for other reasons. This has led many schools and centers to ask what they should do about those fountains. We're recommending that you list your fountains on the enrollment survey and test them now. If you do this, you should run the water from each of these locations for 5 minutes on the Friday before sampling. This will flush out the water that has been sitting in that fountain or tap since it was turned off. It's important, though, that you do not flush on the Monday morning right before you sample. If you'd rather test your fountain later when it's back in use, we do suggest that you keep a do not use sign on it and bag or tape it off so that children or staff can't use it. Since our grant funding only covers one round of testing per site, you may have to pay for additional tests later.
Okay, now we are going to share a few videos on how to do your sample collection and how to ship your samples to the lab. Hi, I'm Jenny Redmond from RTI International. Today I'm going to show you how to sample for lead. Hopefully you have received your testing kit in the mail already. It should look like this. It's a square box and it will be labeled to you after you enroll. Inside the box will be your water bottles for sampling, and up to 16 bottles fit in a box. So if you have more than 16 taps used for drinking or cooking, you may receive more than one box. So step 1 is setting a date. We recommend sampling on a Monday morning because most child care centers are closed over the weekend. The goal is to ensure that nobody has used water for 8 hours so you can collect a first draw sample. Make sure to take your phone out and set an alarm on your phone and put it on your calendar. It's also a good idea to let all of the other teachers know that you plan to do the sampling and anybody that typically comes in early. If you come to the center and notice that somebody has used water already, that's okay. Plan to do your sampling the next Monday morning. Step 2 is making sure your sample box is complete. So in your sample box, you'll have your box, the number of water bottles that you need for the number of drinking and cooking outlets in your center. You will also have a return mailing label to make sure you can mail it back. You will have a chain of custody document that shows where you're sampling and the date and time. You'll have instructions. After checking that your sample box is complete, the next thing you want to do is make sure that your chain of custody document has the sample IDs correctly and are coordinated with the bottles that we've provided. And you want to make sure that you sample in order of the rows on this document. Remember that we are supposed to collect first draw water samples. So you may be tempted to wash your hands before you start, but actually wait, and if you have hand sanitizer nearby, you can use some hand sanitizer if you like to clean your hands. And if you don't have hand sanitizer, that's okay. The goal is to make sure that you don't put your hands on the inside of the bottle where the water will be sitting. Step 3 is to pick up your first bottle that matches with your chain of custody document. Make sure you just take care to open the bottle carefully and pull the cap up without putting your fingers inside the cap or the bottle itself. When you put the water on, you don't turn it on before you put the bottle in. You don't just put the water on a little bit. You want to do the normal speed and then slow it down right as it gets to the top. Make sure you stop before it overflows. Pick up your cap again and turn it over. Close the bottle tightly. Once you're done with your first sample, you're ready to repeat those steps. So if possible, in the week before you do the sampling, check the water fountain and see where you think that the water typically hits, and maybe even put a little marking there. So you are going to angle your bottle and aim to get all of the water. If a little bit of water spills out with the fountain, that's okay. Just try to get as much of the first draw water as you can into the bottle. And if you don't get it in right away, keep the bottle as full as you can. You don't need to spill it out and try again. Once you fill up your water fountain bottle, place the cap on tightly and close it up. Now that you've collected all your water samples, you're ready to fill the date and the time on your chain of custody document. Once you've written down your sample collection date and time, be sure to sign the chain of custody document and date it and put the current time down. There are a few common mistakes that people make when collecting water samples. Number one, make sure that you do not flush water at your center prior to water sampling. That means that no water should be used at the center for at least 8 hours prior to collecting the samples. Second, some taps have aerators that can be removed to clean out debris. You do not want to remove those prior to collecting these samples. Third, there are shut-off valves in the pipes beneath the sinks, and you do not want to close the shut-off valves. Hi again, I'm Jenny Redmond from RTI International. Now that you've watched our video on how to collect water samples, we'll help show you how to ship them to the lab. This center, we have 6 bottles that we just filled, and we're going to place them into the large bag. You want to make sure the bottles are very tight. So you can give it another check and place it in the bag. Up to 5 bottles fit in a row in the bag, and then you can stack another bottle on top. Up to 16 bottles fit in these bags. Once you put all the bottles in the bag, if the bag is not full, you can try to fold it over and zip it up. Seal it well. If you are using all 16 bottles, just seal it like this. Then you will place the bag in the box. Next, you are going to take your chain of custody document and you are going to place it in the smaller Ziploc bag to make sure that it does not get wet. Place your chain of custody in the box as well. Now you will take your return UPS mailing label and place it over the label that the box came in. Now you will close up your box, flaps first. Remove the liner and push down on the adhesive so it's very tight. And now you're ready to call UPS. To schedule the pickup, you can go online to ups.com or you can call UPS at 1-800-742-5877. If you call before 10 a.m., they'll come the same day you call.
This call may be monitored or recorded for quality assurance purposes.
Schedule a pickup.
Schedule a pickup. As an alternative to a pickup, would you like help finding a UPS location where you can drop off your package?
No. You'll need to give UPS your phone number and the tracking number for the shipping label. So there's no charge for you to ship these samples to the lab. The return mailing label will be taken care of. And once you've called UPS, the last step is to make sure you take your box and you put it outside your center so UPS can pick it up. Once you're outside, place your box where you typically receive UPS pickups, in the shade ideally. Now that you've shipped your samples off to the lab, we will notify you when the results are ready. Please watch our next videos to find out what happens in the lab and also what your results mean. Thank you. Okay, there are some specific helpful tips before you sample that we've found. Number one, save your box. You will need this box to ship your bottles back to RTI, or you'll need to find another box. Number two, we recommend that you sample first thing on a Monday morning before anyone has used the water in your building for at least 8 hours. If you have any concerns with this process, let us know in the chat or during the live question and answer. Number three, sample taps in the order provided on the chain of custody form that we give you. Number four, make sure you match the number on the sample bottle to the number on the chain of custody form. Number five, fill each sample bottle all the way to the top before you close it, so we have enough water to test it. Lastly, once you're finished, sign and date your chain of custody form and make sure you include it in your test kit box. And once you close up the box, call UPS right after for same-day pickup using our prepaid return mailing label. Note that if you collect your samples but do not ship them back to us within a week of collecting your water, we will need to send you a new test kit again, and you will have to resample. Since funding covers one round of testing per school, you may have to pay for the shipment materials. So please make sure you do contact UPS that same day to get your box.
We also want to note that samples come in boxes of 18 bottles with 1 bottle per tap. So if you have more than 18 taps, you will receive more than 1 box. Within each box, there is a chain of custody form that matches the bottles in the box. We encourage schools and facilities to develop a sampling plan, especially if they anticipate receiving many boxes. We have helpful resource guides on our program website to help you through this process.
Okay, we'll briefly overview the steps after enrollment. So once you enroll in the online portal, then you'll make sure that everyone involved in doing the sampling has gone through the training by attending the webinar or through our videos online and the written instructions. Those instructions will also be in the test kit that you receive. Once you're trained, and once everyone is trained on how to collect the samples and ship them back to us, you'll go ahead and collect the samples. That same morning, you call UPS for UPS pickup using our prepaid mailing label. UPS will come and collect the test kit, and they'll ship it to RTI Laboratories, where we analyze it for lead. After we get your results, we'll share those with you through your online portal, and you'll get a notification from us by email as well. With each result, we'll provide a recommendation on how to mitigate your risks, and you can decide on the particular no-cost and low-cost solutions that you want to enact at your facility to get the lead out. If any of your results exceed the state action level for lead, the program will send you a follow-up sampling kit to further investigate at those taps. And all along and throughout the process, we're available to communicate with you by phone or through our email system. We also encourage you to communicate early and often with your community. Before sampling, inform your community about your lead monitoring plan. And federal funding requires that you inform parents and staff of the test results after sampling. You can use our public results page to do that if it's helpful. Communication before, after, and throughout the process will support community engagement and trust in your commitment to providing a safe environment for students and staff.
After attending this webinar, if you've still got questions about our program, we've set up a frequently asked questions page that will be updating throughout the program as more questions come in. The page is linked from your Clean Water for Georgia Kids portal and can be found by typing www.cleanwaterforuskids.org/Georgia/FAQ. On the FAQ page, questions are grouped by category, which you can expand and see related questions and answers from within each category. If you've checked out the FAQ and haven't been able to find an answer to a question yet, you can reach out to us on our contact page at www.cleanwaterforuskids.org/Georgia/contact. Or you can feel free to leave us a voice message by calling our help desk line at 1-855-997-3183. The contact page has both a help desk number and an email form you can submit. All of your questions are routed through program staff and will be answered as soon as possible. If your phone call goes to voicemail, you should leave a detailed message with your question, email address, and a callback number. When you leave a voicemail, be prepared to answer a return call from an unknown 855 number. So far, we've received about half voicemail and half email questions through our help desk line.
Okay, what do my results mean? Once we get your results and we notify you on your portal, you'll see each result along with a recommendation. In general, our recommendations fall into 3 categories. 1, we always recommend that you practice no-cost clean water habits, regardless of what your results are. It's important to do things such as only use cold water, even when you're heating it up, because hot water can leach more lead. At 1 parts per billion or above, we do recommend low-cost risk mitigation. That 1 part per billion value is a reference from the American Academy of Pediatrics, again, remember? And low-cost risk mitigation can include things such as replacing a faucet fixture with a new stainless steel one, or installing and maintaining a water filter certified to remove lead. At 15 parts per billion or more, we recommend that you stop use of the water immediately, and we will send you a follow-up test kit to retest the water and provide additional recommendations. We also have a video online about understanding your water test results.
We've got results and mitigation webinars available online. So these webinars show you how to understand and view your results, how to conduct risk mitigation from any lead that you do find in your center's water, and also have some other recommendations on actions you can take next. So again, each of those videos is available on our how-to page at www.cleanwaterforuskids.org/Georgia/how-to.
If results show extensive lead detection throughout your facility, we will email you with guidance for checking your building for lead service lines. Lead service lines and goosenecks were used in many parts of the country to connect water mains coming from water utilities to the plumbing in homes and buildings. And unfortunately, water utilities do not have records of lead service line locations. While large buildings are less likely to have lead service lines, US EPA recommends checking. Checking is pretty simple. You just need a tool like a screwdriver, a magnet, and you need to know where water enters your building. This is typically near your water meter. As a result of the federal funding supporting this free testing, there's a requirement that all results will be posted on our public results page. This page is designed for facilities and the community they serve to view the results. It is not designed to find hotspots. In addition, when you update your portal with your mitigation actions, it will automatically show up in the public results page. This way, the parents, teachers, and students you serve can see the actions you are taking. This will support trust in your commitment to provide a safe environment for students and staff.
Thank you so much for helping us to eliminate early childhood exposure to lead in water.